Hello, everybody. We are here for PrEP Aware Week, and we are joined by our panelists. We are going to be talking about their PrEP experience and what PrEP care has been like for them. My name is Dennis Adey. I am the Supervisor of Sexual Health here at Trillium Health. I have been here for 4 years, and my pronouns are he, him. I'm going to let the panelists introduce themselves, and we will be doing a round-robin discussion about PrEP care with 4 questions. All right, so Marie.
Sure. Hello, everyone. My name is Maria Adelina de la Ferre. My pronouns are she, her, hers, and I've been on PrEP for about 3 years now.
Wonderful. Thank you for joining us. Michael?
Hi, my name is Michael. I go by he, him, and I have been on PrEP for about 5 months.
Well, thank you for joining us. And more.
My name is Moore. My pronouns are he or they, and I've been in PrEP for likewise about 3 years.
Wonderful. Well, thank you all for joining us today, and thank you all for being a part of all of this, talking about PrEP care. As we all know, PrEP is very important and an important tool in the sexual health toolkit. That's our main goal here at Trillium Health. As everybody knows in the Rochester area, you can always get linked up to PrEP care. Quick phone call, 585-454-7737, or just a quick online website, make an appointment, and you are good to go. But today, we're going to be talking about the experiences collectively of how we've all navigated PrEP care, because as we all know, the medical industry can be sometimes a little bit confusing, a little bit flustering, but just talking about how we've made our way through PrEP care, okay? So the first question, I like to start off simple. How did you first get engaged in PrEP care? What was that like for you, getting the first experience of dipping into PrEP care? Give us a little bit of insight of what that was like for you.
Well, my experience so far has been beyond amazing. My journey with PrEP, it started after a relationship. He broke a lot of trust and a lot of confidence. And even though I came out of it safe and sound, the one thing I was very determined is to own my sexual health and make sure that nothing like that happens again. And for me, power is everything, and that includes sexual health.
I love it. The reclamation, that's the main point of it, reclaiming your sexual health. Thank you so much for sharing that. Michael?
So it's actually been something that's kind of been on my radar for many years, honestly, and it wasn't really until I had some encouragement from a friend who's actually a PrEP specialist, and she was really kind of encouraging me to like ask myself, well, why are you not on it? And I think for me there was a lot of shame actually that I kind of had to unpack, and that was like, yeah, kind of going into my sexual health and taking control and ownership over my sexuality, as Marie was kind of saying too. And I think especially in just the past couple of years, it's become very glaringly apparent to me that health isn't just something that's isolated to an individual. And so that was a big impetus for me as well, kind of just opening my eyes to that.
Awesome. Thank you so much. More?
So likewise, it had been on my radar for quite a long while. I'd heard about it in the community, and I had heard about it both when I was taking my degree work as a Master's of Social Work student, and I even took a sex therapy class where we talked about PEP and PrEP. And it wasn't until after I had finished getting my top surgery and I finally started feeling more comfortable in my own skin for getting out in the dating world a lot more that I decided it was time for me to get on PrEP and really go into the dating world protected.
And that's definitely a phrase that I hear a lot, is it's time, and that reclamation of taking control of your sexual health, and how PrEP is really the starting point for that for a lot of people. And for a lot of people too, it's their first time engaging in sexual health. So it's good to hear that that's a commonality, is that it's something, it's time. You're getting ready for it and you're engaging in it because you really want to take control of your sexual health. And that's the important part about PrEP, is reclaiming control of your sexual health. So I always like to follow through with, once you gain control of your sexual health, how has PrEP changed your approach to sexual health? because as we talk about it, it's sort of like evolving into a new landscape. You're introducing new conversations. You're introducing this with your partners, with yourself, navigating how to introduce HIV prevention into your day-to-day. So how has it changed your approach to sexual health and wellness?
I would say I do ask questions about my partners a lot more. Before PrEP, I was really like, whatever happens, happens. But now I'm a lot more conscious about it, and I definitely do like ask questions about like how many partners they've been with, when's the last time you've been tested, and things like that. So again, it definitely does go back to the empowerment, but like also being more open to talk about it. Because again, there's always been this stigma associated with talking about sex and talking about sexual health. So it's definitely changed my perspective of how I approach things in the bed.
Awesome. So like destigmatizing while simultaneously being like, I got this.
Right.
I love to hear it. Thank you. Michael?
Very similarly, I also feel much more comfortable just being candid and asking questions where I really wasn't before, and I thought I was, is kind of the funny thing. And I actually just had like a follow-up appointment today, and just kind of talking through that, I realized, yeah, I feel so much more comfortable just asking these questions, and it feels like it takes the pressure off for some reason.
Awesome. I love to hear it. Also, good timing. Had an appointment today, and now here we are talking all about it. More?
Yeah, so it likewise used to be really hard to get into those conversations about when were you tested, like what's your history with STIs, and really taking that like from, there's so much shame that people have about STIs in general, let alone HIV. But if we're getting tested regularly and we're on PrEP, that gives us a nice little baseline of, hey, I'm getting tested every 3 months. I know what my status is. And if I don't, if something comes up and I think I might have had an exposure, even if it's to another STI, I know where to go to, I know who I can go to, and I know it's okay to have those conversations about my own health as well as to potential partners and with the partners that are existing in my life to let them know and keep them updated.
Yeah, that's a very, very common theme is you start off with this conversation of, hey, I'm on PrEP. And then it sort of like snowballs into when's the last time you were tested? Let's talk about condom use. When, like, are you on PrEP also? So it sort of like expands the field and expands the conversation even more so. And I think that's one of the most common things that I hear when people are from getting first started on PrEP to like 3 months on PrEP to 6 months on PrEP. They talk a little bit more in depth of like, it's so much easier to have that conversation. And it does, it makes it so much easier to be like, okay, I'm on PrEP. With that, the floodgates open. Let's talk about everything sexual health. When's the last time you got tested for syphilis? When's the last time you got tested for chlamydia and gonorrhea? Because sometimes those conversations feel a little awkward, especially when you're getting down to it. So this is just a good barrier and makes it a little bit easier to ease into that conversation. Awesome. So with that, I always like to talk about even more so when it comes to the easy side of the conversations, when it comes to the ease of getting on PrEP and everything. Sometimes it's not always all that easy. We talk about different barriers. There are different communities that face different barriers to engaging in PrEP care. There's different age groups that face barriers to engaging in PrEP care. And as we all know, like I said, the healthcare system's not always the easiest to navigate. So the question is, what, if any, barriers did you face when engaging in PrEP care? And if you had any barriers in engaging in PrEP care, were they overcome and how were they overcome? So it's like a two-part question. Just give us an idea of what you faced going through it.
My experience, and I would say I'm very fortunate and lucky to be in a community that has embraced positive perspectives of sexual health. So being able to get access to PrEP has been beyond phenomenal. Thank you, Trillium Health. But it's been amazing. I haven't had any barriers or problems. I would say the only thing is that I may have forgotten like once or twice because like life got busy and crazy, but just getting right back on it, completely easy.
Awesome. Yeah, and that's a great part about it. 1 or 2 doses, life happens. It's going to happen every once in a while. Thankfully, it's not going to be much of an issue, but it's really great to know that barriers weren't much of an issue, but thankfully we have Trillium. Michael?
Honestly, I also felt very fortunate in that I didn't really encounter many problems. Sorry if that's a boring answer.
I love to
But
hear it.
I think especially since I kind of maybe was later to the game and Trillium has been around for so long, it just felt like everything was set up and everything felt very easy. And before I could even think of questions, people were just like, well, this is what we're going to do. And everything was just set up and so thought out ahead of time. And I did actually have side effects when I first went on. And even then it was something that was taken care of very quickly. And again, just very efficient.
Awesome. Thank you. More?
I likewise didn't have any barriers. I'd already been coming to Trillium for other care. So I was familiar with the place, the people, a lot of familiar faces. It was just a different aspect to my appointments in addition to getting my primary care here. So that went really smoothly. And I know that if something did come up, like I know who to go to and have things resolved. But it also means that as a medical case manager here, I can help other people navigate that.
Thank you. Yeah, that's a really good point to touch on, because it's great that we all know that we have this as a community and we all have Trillium that we can go to. As somebody who moved here about 4 years ago, when I first moved here, I wasn't really sure how to navigate the area. So coming here, whenever I was talking about like, where's a place that I could go for like LGBTQ care, because I want to make sure that I could go a place where I could be me. All of my friends were like, go to Trillium. Don't just go, call right now, go. And then I got a job here. And I honestly feel so at home. And anybody who talks to me in the clinic, sees me walking in the hallways or sees me in the community, knows that it's a great place that I genuinely enjoy. But then, as Moore said, there's the other side of it of helping people navigate that system that initially trying to get into yourself sometimes feels tricky and feels a little awkward and like clunky. But awesome. Yeah. Thank you so much for all your answers too. And one of the things that I always like to talk to is, because I'm talking about like what drew me into Trillium, was I always had a passion for sexual health. And then I was like, this is a no-brainer. Was there anything for any of you that was like a Trillium is it? Was there anything that drew you to us?
I, I guess it was like a natural choice. Because I also go there for like other things. So yeah, I mean, it was just perfect fit. Also, my friends work there as well. So when I was in I don't want to say crisis, but when I was like panicking early in the morning, I was able to message my friends and ask them like, what do I do? What can I do? And they were like, just come to Trillium in the morning. We'll help you get an appointment. We'll get you started and do the tests and everything. So Trillium's phenomenal.
We're like our own little community. I feel like every time I go somewhere, we're like, it's so interwoven, and all of it stems from like, for me, my own little bubble of like being on the PrEP team, being in the clinic, and I love it. It's so nice and like a cozy feeling.
Yeah.
I
Michael?
mean, as you were saying, it really is just kind of like a fixture for the community. And yeah, I mean, I think even in my first visit, I just felt very different from other offices and medical establishments I've been to before, and just very inclusive. And I don't know, I mean, no one ever has like a wonderful time at the doctor, but I actually really did enjoy being at the clinic. And I don't know, I don't dread going to the doctor anymore, so that's great.
Love to hear it. More?
Yeah, so I've been coming here as a patient far longer than I've been working here. I like to out myself here, there, and everywhere. I'm a transmasculine non-binary person, so I've been coming here for hormones and surgical letters and other things, as well as my primary care, as well as my PrEP. And actually being here as a community member is what made me want to work here as a case manager. So like folks have been saying, it's a part of the community and it's interwoven with the community. And I like to give back to that.
And we're glad to have you. And that's the thing that I love about it too, is in even just my time of not even just being somebody who is a part of the PrEP team, but being a PrEP patient also. It was so cool to actually like go out to the bar and see somebody that I saw in the clinic and be like, oh my God, hey, you're not just there in a white lab coat. It doesn't feel awkward. Or just being able to have that access of having people that have similar interests to me that I know are going to be like doing my appointment. Because I don't know about any of you, but I get extreme white coat syndrome. I get very scared. I get very anxious when I go to the doctor. And it was so like refreshing to have somebody that I know is going to have similar interests to me. We could odds are talk about like Netflix or whatever my favorite movie is. And it was just like, it was refreshing. It was so nice. But that's a good part about it, especially, and I'm linking it back to PrEP care, is just that community you get with it and the open conversations, the honest conversations. Being on PrEP, getting engaged in PrEP care really opens that landscape even further, which is awesome. Okay, so last question. This is something that I like to ask everybody that I talk to who's engaged in PrEP care, who really sunk their hands into it. And that's, what advice would you give somebody who is looking to get on PrEP but is still unsure? Because we do have a bunch of people in our community who aren't really sure of what PrEP is or have never heard of it before and are still looking for that little bit of guidance of like, oh, I'm not too sure, like, what do I do? Like, if you have a friend that came to you and said, what do I do? What advice would you give them about PrEP care in terms of just ease of access or your thoughts and your feelings about it?
Just do it. I don't know what else to say. Just do it. Especially if my friends enjoy pleasure and they don't want to deal with the constant fears or worries about HIV, then definitely start PrEP. It's a wonderful and marvelous journey.
I love that. That just do it. We're taking your slogan, Nike. It's definitely what I hear, and just coming full circle from the start of the conversation, that was your, like, that was a common theme that we all heard was like, I just got to do it. And just letting people know, like, it's time, just do it. Love to hear it. Michael?
I mean, same thing. It's like just taking control of your health in that way and being proactive honestly feels really good. And sometimes when you're in the limbo, you just make yourself more nervous for no reason. And there really are just so many programs and systems that are in place, and we're so great, like we're so lucky to have Trillium because it's so easy to branch into these support systems. And it really does feel like it's actually a very accessible treatment option for people.
Awesome. Love to hear it. More?
I think if I had a friend coming to me who was nervous about coming out or making the call, I'd say, hey, you want to practice it with me? If you need someone to meet you here just to be a buddy in the waiting room, I'll be there. I'll check in, see how it's going. Basically, like everybody else said, don't wait. If you know that it's something that you might be interested in, or even if you just think you might be interested in it, it's 1 pill a day. It's pretty low impact as medication regimens go. And if you have like a daily routine that you take a vitamin, you can take PrEP.
Mm-hmm. And that's the biggest part about it, is it's so easy, and taking it every day. If you're used to, like you said, taking a medication every day, just toss another one in there. But yeah, just the just do it attitude is definitely what I give a lot of patients when I have people who are like, oh, I'm not too sure if I should do it or not. Sexual health is a unique experience for everybody. Their own sexual health and experience is their own. But one thing that, as we all know, can bring us all together is the reclamation of our own sexual health and how important that can be and how liberating it can feel. And just my own personal experience was PrEP was such a phenomenal like leap forward for that, for somebody who always felt the stigma for being who I was and feeling a lot of pressure to sort of assert myself into like, I'm here, I'm a young queer man, I need to be sexually active, and having to assert myself into that. PrEP really helped me reclaim who I am and reclaim my sexual health. And that's a common theme that I heard from everybody. So I just want to thank you all for sharing all of your stories. You were absolutely phenomenal. And I consider you all my friends. And I'm so glad that you could all be here for us today to help celebrate Prep Aware Week. And thank you again.